Hello everyone, my name is Neha Danavle from Brisang Training Institute and I'm going to share this technical video on blood pressure. Blood pressure is the pressure which is exerted by the blood on the walls of artery or the walls of blood vessels, and mainly this blood pressure is results due to or because of heart, which pumps the blood through the circulatory system to the body parts of body. That's how they reach to the cells or the tissue organs uh, for the oxygen supply to that body part. Mainly this mainly this mainly this blood pressure is measured and brachial artery, which is present in arms. That brachial artery helps to measure the blood pressure with the help of sphygmomanometer. And this blood pressure is also expressed in terms of systolic blood pressure and diastolic blood pressure. That systolic pressure is the maximum pressure during the heartbeat, and diastolic pressure is the minimum pressure when heart relax. That's a combination with the systolic and diastolic, it forms the cardiac cycle. And this blood pressure is mainly measured in mmHg, which is millimeter of mercury. And this systolic and diastolic pressure is also known as a pulse pressure. When and the average pressure during this cardiac cycle is also known as the mean arterial pressure. And the healthcare professional also measure this blood pressure by non the, measure this blood pressure by auscultation. Auscultation means listening through a stethoscope for sounds in one arm's artery, which is a brachial artery. As this artery is squeezed and close to the heart by an aneroid or a mercury tube sphygmomanometer. And this auscultation is still in use by the healthcare professional, and it also gives the accurate result of blood pressure in reading that blood pressure at clinical level. Blood pressure is mainly influenced by the cardiac output, systolic vascular resistance, and also due to the blood volume, and because of the stiffening of artery. And it also depends or varies from person to person due to the situation of that person, like emotional situation or any activities or a relative health condition of that person, that leads to the varying the blood pressure in person to person. And this blood pressure is regulated by the baroreceptor, which is present in blood vessels, that acts on the brain to influence the nervous and the endocrine system at time, that helps to maintain the blood pressure. And the blood pressure is when the blood pressure is too low, then we called as a hypotension. And there is a hypertension in which there is a too much blood pressure, that term we call hypertension. The hypertension is mainly due to the many cause. And because of that it leads to the and it leads to or that have a long term duration, that don't cure that not cure with any that cure that not cure, that requires the medication to control that blood pressure. And this results in stroke, heart diseases, or it also results in kidney failure also. And because of that the hypertension is long term side effect, or it is long term, and long term compared to the hypertension. And this requires the medication. There are some hypertension medication that controls the blood pressure, like and they are ARB, ACE, And also there is a and there is also the adrenergic drugs which uh, helps to monitor or maintain the blood pressure by minimizing or by dilating. uh, there are also the nitrate which dilate the blood pressure, dilates the blood vessel, that helps to flow the blood in normal way. That's how that we can maintain that blood pressure through medications. That's all. Thank you.